So our camera comes on. Okay, go ahead. Welcome back, committee members, ministers, and officials. We will resume consideration of the estimates and supplementary estimates number 2 for the Ministry of Health, vote 32. Central Management and Services, sub-vote HE01. I will now open the floor for Minister Hindley.
Thank you, Madam Chair. And I think before the break here, we endeavored to try and get some answers to the questions that the member opposite asked about emergency room data. And I think we've been able to pull some of that information. So I'm just going to have the officials come forward and share the data that we have thus far.
Dave Morehart, Executive Director of Acute Emergency Services Branch with the Ministry of Health. So I do have some of the data that you were asking for those 5 communities. So the first was on the time to the physician initial assessment. This data is in minutes. So in Saskatoon, it was, and this is for the 90th percentile. So it would be 260 minutes in Saskatoon, 391 in Regina, 249 in North Battleford, 284 in Prince Albert, and 257 in Lloydminster. Then the next piece was on the time wait to an inpatient bed. And this is in hours, and also the 90th percentile. In Saskatoon, it was 68.3, Regina, 38.6, North Battleford, 3.9, Prince Albert, 3.7, and Lloydminster, 23.8. The next is on the total ED length of stay for those patients that were admitted. In Saskatoon, it was, and this is in hours as well, in 90th percentile. In Saskatoon, it was 77.9, Regina, 47.7, North Battleford, 13.75, Prince Albert, 14.7, and Lloydminster, 34.2. Pardon me?
Hours or minutes? Sorry.
That was in hours as well, and 90th percentile. And then last is the total length of stay in the emergency department for those patients that were discharged or not admitted. And this would be hours as well, and 90th percentile. Saskatoon was 8.6, Regina 11.6, North Battleford 6.5, Prince Albert 8.6, and Lloydminster 9 hours. And I would note as well that that data is from November of 2023, which is the most recent reported data that we have.
Obviously, I mean, we see in some of these numbers the wait times, and and backlog in both Regina and Saskatoon. The government has announced back in October around the capacity pressure action plan. Minister, I'm wondering if you can just speak to kind of update us with where we're at with that action plan.
With just providing some high-level indication of some of the steps that are being taken. I think then Andrew Will, CEO of the SHA, will provide us with a current status update. So some of the things that we're trying to do in both Regina and Saskatoon to address the capacity pressures there that we are facing, and the SHA announced the Saskatoon capacity pressure action plan in November, and then Regina was announced in December, I think is when it was. Anyways, to improve flow in the emergency departments, a number of initiatives underway, which Andrew will speak to here just in terms of where we're at, such as increasing capacity within acute care to prevent admitted patients from waiting in the emergency departments, enabling staff to be able to deliver care safely with support teams in place, reducing the number of and finding a better place for people who might be homeless that are occupying the emergency departments, reducing the number of admissions that could be better cared for in other places in the community with SHA supports, and having those people redirected to the right locations, some improvements to workspace to accommodate the staff and improve patient line of sight, some additional protocols that are being developed. Improved discharge planning to enable patients to move home quicker and in a more expedient fashion, increasing some of the bed capacity within the community to move some of those ALC patients out of acute care facilities and eventually to get them back home, but into other facilities might be better able to serve their needs. And there's some other long-term work being done around beds needs analysis for the cities of Regina and Saskatoon. Anyway, those are some of the high-level initiatives and actions that are being undertaken, many in conjunction with what we're hearing from frontline staff. When I know that in the case of Saskatoon, for example, where I've had the opportunity to talk to frontline staff at St. Paul's Hospital, as an example, on a number of occasions, and I know that the SHA senior leadership has been there as well, including in Regina. But with that, maybe just turn it over to Mr. Will to provide a current status update on the initiatives we have underway and the progress that's being made thus far.
Thanks, Minister. Andrew Will, CEO with the Saskatchewan Health Authority. And I'd like to just start by saying, this is certainly an issue that is important the Saskatchewan Health Authority, and we acknowledge that in times when our emergency departments are over capacity, that it has an impact on patients and families, and certainly staff and physicians that work there as well. You know, when they shared the data in terms of the time to see a physician and, you know, times for admission, you know, that was at a point in time in particular where respiratory illnesses were really impacting the emergency departments, and you know, it was a challenging time, and we're still facing pressures, and I acknowledge that. So I'm thankful for patience of the public and patience of our staff and physicians as we work to find solutions to improve this situation. I'll say that I also want to thank our staff and physicians for ideas that they've shared with us that really helped build our capacity action response plans for both Saskatoon and Regina. And as we've gone forward with those plans, you know, publicly, and those plans were developed also in collaboration with the Ministry of Health, you know, we've been advancing really, you know, I would describe at a high level 3 components. Like, one is, how do we ensure we have enough capacity for patients, and that would be, you know, not only you know, in inpatient wards in the hospital, but can we support patients that no longer require hospital care to flow into long-term care or into community-based care. So the action plan really focuses on additional capacity in the hospitals, but also leveraging capacity in the community to support alternate level of care patients to transition into better locations for their ongoing care. The second component is additional staffing, and I'll give some more details on that. But we really listened to staff. We took their feedback, and there's been investments in, you know, nursing staff, protective services, housekeeping, really anything that would help us address the overcapacity situation that we're in. And then the third aspect of the plan is really, again, in collaboration with the Ministry of Health, looking at what are our long-term bed needs for acute care in Saskatoon and Regina, and also our long-term care bed needs for Saskatoon in particular, knowing that there is already investment happening in Regina. All of these things were part of what we announced publicly for both the Saskatoon and Regina plans. And, you know, as you'd be aware, we have been hosting public updates for media and others to hear the progress that we're making on the plan. You know, I just, again, you know, I do want to say a thank you to the Ministry of Health for the investments that are helping us to advance this plan. And maybe I'll just highlight some stats at a provincial level. Since the initial implementation of the action plans, we've hired more than 156 additional full-time equivalents in Saskatoon and Regina, including more than 60 additional nursing positions. Efforts are underway to recruit an additional 290 staff combined between Saskatoon and Regina, including an additional 107 FTEs of nurses. As part of the action plan, we've implemented 206 beds in community settings to better facilitate discharge and care transitions for patients from acute care to more appropriate settings. I'll just give a breakdown for both Saskatoon and Regina. In Saskatoon, we have 159 new beds in community settings. That includes 84 long-term care beds and 75 convalescent care beds. These beds will help reduce pressure in acute care facilities and better facilitate the delivery of appropriate care in an appropriate care setting. And I'll just say we've seen some really good results in reductions to alternate level of care patients, particularly in Saskatoon. And just, I guess, to define what alternate level of care means, it's meant to describe patients that have been determined by clinicians to no longer require an acute care admission, but they're not ready necessarily to transition to home without additional support. So often long-term care or convalescent type of care is what is required. In addition to those 159 beds, we've also hired specifically for Saskatoon 140 full FTEs of staff, including 55 nurses, 15 security officers, 70 FTEs of various designations, including therapists, continuing care aides, environmental services workers, unit support workers, home care schedulers, and pharmacists. And I'll say that also includes the location of some of our primary care team in hospital to help arrange other care settings in community with support of home care. We continue our recruitment efforts in Saskatoon to fill an additional 245 FTEs of various designations, including 89 more nursing FTEs. In Saskatoon, there's a total of 75 convalescent care beds that have been added to expand community capacity, with 68 of these beds that are currently occupied. Of the 84 new long-term care beds, 40 beds are projected to be operational by May the 1st, with the remaining 44 beds to be operational by June the 3rd. We continue to operate an additional 43 acute care beds and 8 EMS offload beds at Royal University Hospital, along with 5 acute care beds at St. Paul's Hospital. I just want to say, kind of call out a special partnership that has happened. We've developed a partnership with the Saskatoon Tribal Council, which has resulted in collaborative efforts to divert more than 650 individuals from St. Paul's Hospital to other primary care or shelter locations from December 1st to February 29th. And I'll just say, like, again, it's providing, I think, better care and supports to those individuals and making a noticeable difference in terms of the experience for patients and staff in our emergency rooms as well. With respect to Regina, there are 47 new beds in community settings, including 20 transitional care beds at the Regina Lutheran Home and 27 community-based long-term care beds in Regina, providing SHA with an additional 47 beds to facilitate discharge and care transitions for patients from acute care to appropriate settings. We've hired 16 staff, 16 FTEs, including 5 FTEs of nurses, and recruitments are underway to fill an additional 46 FTEs of staff, including an additional 18 nursing positions. This includes all staff needed to operate the 20 new transition beds at Regina Lutheran Care Home. In partnership with the Ministry of Health and Social Services, we have 20 new supportive housing spaces that have been opened at the Niwo Yutina Friendship Center for individuals with complex needs. And it was exciting today to be at the event to see the final completion of construction for the Regina Urgent Care Center as well. And it's just going to be a great facility and provide an option for the public that will reduce the amount of patients that we see in our emergency rooms and provide another option for non-emergent but urgent care. I will also just mention, with respect to Regina, we've worked together with Ministry of Health and Sask Builds on procurement with 2 RFPs that have been posted for 220 standardized long-term care beds, in addition to the previously committed 240 specialized long-term care beds. So together, that will add significant capacity for Regina and again take pressure off of alternate level of care patients that we might see in the hospital. And I'll just maybe close my comments by saying, we're moving these initiatives forward. We continue to listen to feedback from our staff and physicians, and we will continue to adapt these plans as we go along to get the outcome that's needed to serve patients and families in a good way.
Thank you. I'm wondering around the capacity pressure action plan, we're certainly hearing that issues remain front and center in our ERs, and I'm wondering what kind of metrics are you using to quantify that the action plan is actually improving or that it's working. Last week we saw, the triage desk at St. Paul with the right to refuse work. We've seen fire code violations a few months ago. What is the metric that you're using to suggest that the action plan is actually reducing wait times, reducing how long it's taking patients to flow through the ER? So metrics, and who's involved in monitoring those metrics?
So and Andrew will get into the specifics, but there are metrics that the SHA uses all the time to be able to monitor these situations, regardless of whether there's a capacity pressure challenges in this case in Saskatoon and Regina, and Andrew can speak to those metrics and what we use to measure what's happening and the progress in this case of the impact of the capacity pressure action plan initiatives, knowing that just based on some of the information that Mr. Will provided tonight, that some of this is a bit more immediate, some of it will take some time in order to see the benefits of that. We're talking about adding more bed capacity, for example, to be able to provide other avenues for patients outside of using the emergency department and acute care beds in these hospitals. And I think one of the most important metrics that we have is also the engagement with the staff, which I know has happened on a regular basis, both in Regina and Saskatoon. It continues to happen. I've been there present several times. I've talked to staff several times myself directly. The SHA, I know that Andrew has been there. Senior leadership from the SHA have been, I think, on the ground in the emergency department area, proper 2, 3, perhaps more times a week to make sure that they are A, seeing it firsthand, B, being able to talk to those frontline healthcare providers to be able to say, here's the steps we're taking, here's the progress that's happening, here's kind of what's next, so that there's a very clear and open line of communication between nurses and other doctors and other frontline healthcare providers in the hospitals and with the SHA, so that door of communication is open. They can continue to be having these discussions even outside of formal meetings, to be able to say, here's where some of the things the changes that are being made and implemented and the impact that that's having Some of it is being witnessed a bit more immediately, and as I said, others will take a little bit of time here. But Andrew, if maybe you just want to speak about the metrics that the SHA uses to monitor the capacity and how we're monitoring the results of the initiatives that we're implementing.
Yeah, thanks, Minister Henley. Maybe just a few thoughts to add to comments that you've made. And certainly, you know, previously some of the measures that you described are important, and there's others. I mentioned alternate level of care beds. That is something that we do monitor closely. You know, not only in terms of ensuring we've got capacity to admit patients from the emergency room, but also knowing that those alternate level of care beds patients would be better served elsewhere. We also look at admit no beds, we call them, and basically that is, you know, when we do have patients in the emergency room that have been admitted into care of a physician and are waiting for transition up into an acute care ward. So we do track that. And I'll just say, you know, another one that we've spoken about publicly and also, you know, in connecting with our EMS providers is offload delays for ambulances as well. You know, I would just say all of these efforts that are underway, you know, as Minister Henley said, like they will take time. We don't expect that we'll get an immediate result from all of these different actions, but we are seeing improvements. You know, in terms of alternate levels of care, as I mentioned earlier, Saskatoon has seen a significant drop in ALCs, and we do see fluctuations. As I mentioned, you know, during respiratory season, it really put pressure on our facilities. Similarly, you'll recall in Saskatoon a number of months ago, you know, we had very icy conditions, and you know, slips and falls were bringing people into our emergency room as well. So there's times when we're busier, and then there's times when things do get better. I will also say, you know, we have seen things stabilize fairly well in Regina lately. So there's some, you know, hope there that we're pushing through. I think some of the challenges that we're facing there, but I will acknowledge we are still facing challenges in Saskatoon. And you know, as Minister Henley said, I think, you know, one of the, you know, certainly feedback from our staff is an important measure of, like, are we making progress or not? And you know, I'm hoping that they're seeing the actions that we're taking, and that they see that this is important to us, and I'm hoping that they also are seeing that, you know, their ideas are part of the plan that we're implementing, and I hope they continue to share those ideas with us so that we can continue to achieve the outcomes that we need to. And maybe one more comment, like some of I mentioned the 3 parts of the plan in terms of bed capacity in and out of hospital, staffing, but also the longer term planning. And I would just say, I think that part will be important for us as well to ensure that we are able to meet growing demands over time. Oh, one other point, like I certainly the investment in the Prince Albert Victoria Hospital redevelopment will bring on additional capacity for us that I think will support Saskatoon in terms of, you know, less transfers coming from Prince Albert in the north. And we're also working very hard to look at, you know, are there opportunities for patients that could be cared for in community and regional hospitals to receive care there rather than, you know, coming straight into to Saskatoon. So anyway, there's your key question was measures, and I think there's certainly lots of you know, leading measures on the actions that we're taking, and over time, you know, we're starting to see some results from outcome measures as well.
Thank you. So would you say, based on on the ALC beds metrics, on the admit no bed metrics, that the plan is working? It was my understanding there are 83 ALC patients in Saskatoon hospitals this evening. Is this plan working?
in Saskatoon, and I would preface this by saying that the plan is working, the capacity pressure action plans, which there's significant dollars tied to this to increase staffing, to improve patient flow, to make sure that we're doing everything we can to triage patients. You know, and working with our EMS partners as well, we are seeing positive results from the capacity pressure action plan. So in Saskatoon at Royal University Hospital, since the implementation of the capacity action plan, there's been a 70% decrease in the number of alternative level of care ALC patients. And at St. Paul's Hospital, in Saskatoon, there has been a 16% decrease in the volume of ALC patients there as well. Again, continuing to engage with frontline leaders and healthcare providers on additional changes that can be made to the capacity pressure action plans to continue to reduce those numbers.
When you reference those numbers, Minister, are they, you know, averages, daily averages across time, or are they just points that you've pulled, say, 5 months ago to today, or where did those numbers come from when the 70 and the 16% decrease?
Just thanks for that question. I'll just clarify. That calculation is based on the median ALC for Saskatoon prior to the implementation of the plan, and then a comparison to the median ALC post-implementation of the plan. And of course, the implementation continues, but we basically took that point forward, and that's the improvement that we've achieved.
Thank you. Two quick questions on the capacity pressure action plan. There was money announced with the plan back in November, December. How has that money transferred over into this 2024-2025 budget estimate? So was the money all spent in November, December? Is this new money that's in this fiscal year budget? I'll leave it at that for this moment.
Thanks for the question. So just to confirm, this year's budget does provide 30 million for this work with respect to the Saskatoon and Regina action plans.
Just for clarity, does that mean was the $30 million spent in last fiscal year, and so this is a new $30 million, or is it the same money kind of transferring over?
These are new dollars, and because I guess how I would frame up when the action plans came into place, it was quite late in the latter part of last year, and so even just sort of understanding what was spent, we're still in the process of kind of reconciling what those numbers are, seeing that the fiscal year just ended. But I guess the main point being that the 30 million is new dollars for this year for these plans.
Thank you. Just a question on clarity. When we were talking ALC beds and the metrics and the reductions of 70% in 16 at St. Paul's and 70 at RUH, thank you. Mr. Wills referenced median, the median averages. Do you have the mean averages of ALC beds and how they've changed over time?
The median as a more reliable measure to indicate kind of the trend that we're seeing. Like a mean rate, a significant fluctuation could really, I think misrepresent, what is the ongoing experience over time. So median is the measure that we're using to assess the performance of the plan.
Thank you. Yesterday, the minister tabled a list of the agencies for contract nurses. Minister, is this an up-to-date list of all the agencies that are being contracted right now?
The list that would have been tabled before fiscal year 23-24. So that's the most current list, yeah.
What was the total cost of contract nurses for 23-24? And what do you expect in 2024-25?
Hi, Greg Gettle, Assistant Deputy Minister with the Ministry of Health. So to answer the first question, we haven't finished the full fiscal year for 23-24 because that year just recently ended. We haven't done the full reconciliation, so we don't have a final number for 23-24. And then for 24-25, we don't do a projection. It's just based on the actual usage and need of the system.
Would you have a total for 22-23 then for contract nurses?
In calendar year, that's the number that we have, the officials have, calendar year 2023, $59 million.
Thank you, Minister. I'm surprised that you aren't budgeting contract nurses in 2020, 2024, 25, given, you know, 59 million in the calendar year. Would we expect to see like a special warrant to cover that cost at the end of the fiscal year?
So thanks. Further to what I said earlier, in the 2023 calendar year, the SHA reported nursing contract or contract nursing cost $59 million, roughly 1% of the total budget amounts provided to the SHA. So it's a small percentage of the SHA's overall budget. Turn it over to Norm here in a second, but I would just say that as I've said previously, that we use contract nurses when necessary to reduce service disruptions in healthcare facilities across the province. And in addition to that, they are providing relief. And I know when I talk to frontline healthcare providers and nurses, and I talked to some as recently as last week, as a matter of fact, at a rural facility or a rural community, and they talked about how important it has been for them to be able to have contract nurses helping out temporarily. It allows them to take vacations and things like that, provide training and support for new nurses as well who are new to the system. So they do provide value in that respect in terms of the support that they provide on a contracted basis. Of course, ultimately working to permanently fill those positions with nurses that can take those positions on a permanent full-time basis. And maybe Norm, I'll let you just talk a bit more about how the contract nursing works in terms of staffing and budgeting amounts.
Sure. So I think maybe in follow-up to the question about whether or not having it budgeted results in a special warrant. So it's trickier to say than just like that cost would just be warranted out. You have to think about the size of the overall SHA budget being around $4 billion, that there's many moving parts. So you're going to have a variety of pressures and offsets. And so there's areas of small percentage savings can result in quite large dollars given the size of that budget. And they'd be used to offset some of those contracted nursing costs. So you might end up with some compensation savings somewhere else where we're having difficulty to recruit positions. And you could redirect those savings that are budgeted to where you're using contracts to fill that gap.
Thank you. How many contract nurses are in the workforce currently, and which communities are most heavily rely on these agencies?
Okay, so of the 18,000 nurses of all designations that we have in the province, we have roughly 242 is the most current stat that we have, 242 contract or agency nurses. That's a point in time number. Of that 242, 112 would be deployed and working in Saskatoon and Regina. The remaining 130 working across northern and rural locations. Again, that's a number from this past February, which I think is the most recent information that we have. And knowing, of course, that that number fluctuates on a regular basis, you have nurses sometimes that come in to deal with the potential service disruption because they're filling perhaps a maternity leave, as an example. Sometimes you have contract nurses coming in for maybe only a week to cover shifts, and that may be required. So again, point in time numbers, and that's 242 is the number we have.
And that would be February 2024? Okay, yeah, thank you. Moving on to specialist wait times, how many people are currently waiting to see a specialist in Saskatchewan?
So thank you for the question. We actually do not collect data on how many patients are waiting to see a specialist. It's a direct referral from a family physician to a specialist, and there's no tracking in the Ministry of Health for how many patients might be waiting. We do have some information. It's not great information on how long patients are waiting, but not how many.
That leads me into my next question. What are the current wait times for the top 20 specialists in the province, both medical and surgical?
Okay, so I can provide the, we have actually 20 specialty groups that we have this data for. So I'll just provide the specialty and the average wait time in days. And this is for the period April 2023 to September 2023. So the average wait time in days for physical medicine and rehab, so for physiatry, is 181 days. For neurosurgery, 170 days. For respirology, 166 days. For neurology, 159 days. For gastroenterology, 143 days. For nephrology, 143. For cardiology, 143. For rheumatology, 142. Dermatology, 135. Orthopedic surgery, 132. Obstetrics and gynecology, 132. Otolaryngology, 132. Internal medicine, 121. Urology, 121. Plastic surgery, 116. Ophthalmology, 115. Psychiatry, 105. General surgery, 99. Pediatrics, 91. And endocrinology, 89 days.
Thank you. Would that be the most recent data you have?
Yes, it would be the most recent.
Thank you. Looking specifically at pediatric specialties, wondering how many vacancies there are in each specialty that are current. So how many vacancies across the province in pediatric specialties?
All right, so in terms of vacant positions that are being recruited into, we have one general pediatrician posting for Lloydminster, one for Swift Current, one for Moose Jaw, and 2 for Regina. We have 4.5 vacancies for JPCH in Saskatoon, and then 4.5 other general pediatricians in Saskatoon as well. We have 6 vacant positions right now where physicians have committed to start. So, you know, they've indicated they want to come, they're interested in that job, they've signed letters of offer, and they will be starting in the coming, 6 to 12 months.
Thank you. What's the plan for pediatric gastroenterology? Do we still only have one locum pediatric gastroenterologist?
So with the pediatric gastroenterology program at Jim Pattison's Children's Hospital, we have been actively recruiting for filling the positions and filling those vacancies. As you likely know, that we do have a rotation of locum specialists covering, providing that care for families and for Saskatchewan children as close to home as possible. It's our understanding that we are in contract discussions with a couple of pediatric gastroenterologists here, and we'll hopefully have those secured in the near future. And I think Ingrid might just want to talk about some of the other investments in this area as well.
Sure, thanks, Minister. While we were recruiting, knowing that we're relying on locums to provide some services to our patients, over the last 2 budget cycles, we have continued to invest in pediatric gastroenterology through a multidisciplinary team. So in 23-24, we received $2.2 million, and then an additional $600,000. I'm reading my table right, $600,000 in 24-25. And that has allowed us to support hiring a nurse practitioner, hiring additional registered nurses, hiring a pharmacist to support those patients, as well as additional endoscopy clinical support staff as well. A lot of these patients need pediatric gastroscopies. And so you know, we've hired about 7 FTEs to date, and we'll continue to hire another 7 FTEs in 2024.
I'd like to just circle back just to pick up on one thing that was mentioned around the vacancies for the specialties, the specialists rather. You mentioned 4.5 vacancies at Jim Pattison's Children's Hospital. I'm wondering, can you break those down as to what specialties those 4.5 positions are?
So the specialties where we're recruiting currently at Jim Pattison Children's Hospital are in pediatric cardiology, pediatric neurology, pediatric gastroenterology, and pediatric respirology.
And then where would that 0.5 be? Where would the 0.5 be? Because they said it was stated 4.5 positions or vacancies. And
so there's a 0.5 in pediatric cardiology, 1.5 in pediatric neurology, 1.5 pediatric gastroenterology, and 1.0 pediatric respirology. So that's your 4.5.
How many pediatric cardiologists do we currently have, and are they all stationed at the Jim Pattison Children's Hospital?
We have 4, and they're all at JPCH.
What's the capacity at JPCH currently? Are all the beds open?
Thanks for the question. All of the beds at JPCH are open, is my understanding.
Thank you. Moving to breast cancer care, I'm wondering how many people are on the waiting list for mammograms and biopsies currently?
So currently, so we have data for Regina. So we have the number of patients waiting for the Regina Breast Assessment Center. We don't have information for Saskatoon at this time. So in Regina, there are 152 patients waiting for a diagnostic breast biopsy. And again, in Regina, there was 129 patients waiting for a diagnostic breast mammography. I would note this is only patients waiting at the Regina Breast Assessment Center. What also happens is patients are referred for the diagnostic mammography directly to community partners. So you can go to Mayfair and Regina, for example, and have a mammography done there. We don't have wait time or wait numbers for stuff done in that community center. So this is just for the Regina Breast Assessment Center.
Why wouldn't you have that information for Saskatoon?
So there's a bit of a different model in Saskatoon. So in Saskatoon, all of the diagnostic mammography is done in the community. So it would be the situation like where a family physician could refer the patient to, to the Mayfair in Saskatoon or other community partner, and you have your images done there. And we don't collect wait time for that information. We can get information on the Saskatoon Breast Assessment Center. We just don't have it here with us today. Typically the challenges with breast imaging have been in Regina, and Saskatoon has been much more able to manage their volumes and their wait times. So the focus of our work has been on supporting Regina.
My understanding is that there's two types of mammograms, diagnostic and screening. Can you give an idea of the wait list for screening mammograms in Regina?
Hi, Deb Bullich, CEO, Saskatchewan Cancer Agency. So to answer your question in terms of the wait list for screening mammography in Regina, we currently know that we have 6,400 patients in the queue. However, the good news is we are booking into January of 25, which seems like a significant period of time, but we are offering all of these women the opportunity to go to another screening site in Saskatchewan, and 5 of them are completely caught up. We are also working, looking at Mayfair as a private diagnostic, or not diagnostic, but a private community partner for screening mammography to build capacity as well.
Thank you. I'm wondering, it was mentioned that you didn't have the Saskatoon diagnostic and screening wait list for mammographies and biopsies. I'm wondering if that could be tabled for tomorrow.
Thank you. So I just did a check-in with the team, and we can make the request to start to see what we can do to gather that data. We'll make every effort to have that information for tomorrow, but I can't guarantee that we'll have it all in time for estimates. But we'll start the process. Thank you.
Can you tell me how many women have been sent out of province for breast health diagnostic? And to date so far, out to Calgary, and how much has been spent on that?
To date, thus far, 204 women have accepted a referral to Calgary, and 165 of those patients have had their diagnostic procedures completed already. That's the most current information we have. And then Ingrid will talk just a bit about the cost and the amount that's been spent thus far.
Thanks, Minister. So based on the cost per procedure for those 165 patients, we would forecast to spend about $330,000 on the procedures themselves. In addition, for patients who are going out of province, we are covering their expenses. And so we've spent $179,000 for those expenses for patients. I would note that the cost per procedure that we are paying includes all costs associated with the diagnostic procedure itself, including the radiologist review of patient information and any previous imaging prior to that appointment, so the screening of the radiologist to ensure the patient meets their clinical requirements to get that service, the diagnostic mammography itself, the radiologist review and interpretation of that imaging, ultrasound-guided biopsy procedures, and insertion of markers if required, as well as pathology and lab services. And then the cost of also transferring those images and results back to Saskatchewan and administrative fees. So they are doing some of the additional work around the lab components, and so that's included in the cost as well.
Thank you. In terms of the reimbursements for women who are going to Calgary, what is covered for reimbursement in terms of travel and accommodation, and what is not covered?
So I can just kind of read out, we have a form for allowable expenses that's associated with this initiative. So I can just read that out. And so A patient that is selected to travel out of province for their diagnostic breast procedures would be eligible for maximum reimbursement of $1,500. And that would be for transportation, a per diem, and accommodations for one patient and one support person. For transportation costs, it would be the cost of one return trip from Saskatchewan to Calgary. If they were to go by private vehicle, it would be reimbursed at current government rates at 57 cents a kilometer, or travel by commercial carrier, so if it was air, rail, or bus, with a receipt for that. Per diem expenses would include meals, gratuities, parking, taxi, and per diem claims are $56 per person for each day, and that would be for a maximum of one patient and one support person. And the daily per diem expenses are paid for a maximum of 2 days, and no receipts are required for the per diem claims. And then accommodations would be actual expenses for accommodation per night, and it would be to a total of $1,500 maximum.
Would the travel include transportation from, say, the airport to a hospital to get the test? So like an Uber or a taxi or a car rental?
That would be included as part of the per diem.
Is it per diem?
Yeah, as part of the daily per diem would include the taxi.
Okay. Thank you. I just scribbled down a note. I missed this earlier. Do you have the screening numbers for Saskatoon for breast cancer here? We talked about screening and diagnostic, and you didn't have the Saskatoon numbers. Do you have screening numbers for Saskatoon of the wait list? Sorry.
So sorry to keep you waiting. I lost my sheet. I'm just being honest. But the good news is that Saskatoon is one of the mammography screening centers that is caught up.
So no wait list then?
No. So I should explain that the guidelines for breast screening mammography are every 2 years. And then there is a certain category of women that are every 1 year. And caught up means that we're meeting all of those guidelines. No one is waiting outside of those guidelines.
Okay, thank you. Switching gears to the Health Recruitment Agency, I'm wondering how many dollars are being allocated there and how will these dollars be used? Will we see how many full-time equivalents being hired into the agency? So how are dollars being allocated and how many full-time FTEs are being hired into the agency? We're running out of time, so I'm going to rapid fire these. There we go. I like that initiative, Minister.
Hi, I'm Erin Brady, the CEO of the Saskatchewan Healthcare Recruitment Agency. And our 23-24 budget was $2.4 million, and we were hiring 11 people.
Sorry, can you just, what year was that for?
Okay.
Sorry.
That's good. 23-24.
Thank you. What's the mandate going to be for the organization?
The mandate of the organization is to develop and implement strategies and tactics that facilitate the local, national, and international recruitment, retention, transition or path to practice, and placement of health professionals in Saskatchewan in collaboration and coordination with our provincial and local stakeholders.
How soon will the agency be up and running and recruiting healthcare workers?
So the Health Recruitment Agency has been, Ms. Brady was hired as formally as a CEO last May, I think it was when she took the position, and then since that point in time has been working to fully staff the operation, and they have been very active, I would say, in not only filling the FTEs to make sure they have a full team to be able to do the recruitment that's necessary, that we as government has identified as a priority for us. And I would say that Ms. Brady and her team have been doing an excellent job in that, in terms of engaging with frontline healthcare providers, being visible at recruitment types of activities, both I think outside the province, but also in province as well. One example I think of most recently was the Saskatchewan Association of Rural Municipalities Convention, where I believe the SHRA had a booth there and had staff there engaging with rural leaders and rural communities on staffing challenges that exist in certain locations in rural Saskatchewan. But I'd maybe turn it over to Aaron in terms of a bit more data around points of contacts that have been made thus far and the engagement they've been having with those people.
Sure. Okay. So I can highlight a few things for you. So we were at the SARM convention last month, and we were able to speak with 56 people across 51 municipalities. And we've also had one-on-one conversations with some of those communities, and we will be at the SUMA convention this month as well. We have attended or hosted 11 events in the province with learners and residents. We've attended 3 national events, hosted or attended 7 virtual events, and 2 international events. And those international events, it was 2 events in one trip, just consecutive days.
Thank you. Will your organization have a mandate to coordinate with post-secondary institutions? I'm thinking advanced education, immigration. I'll leave that.
I would say yes, that the Sask Health Recruitment Agency and Erin and her team would be working very closely with those other ministries and agencies. It really is a multifaceted approach when it comes to recruitment and retention of healthcare workers. And just as an example, we've talked about the number of nursing grads from Saskatchewan and other Canadian provinces that have been hired here in Saskatchewan in the past number of months. But the Health Recruitment Agency would be working very closely with the training institutions to make sure that we are in partnership with them, trying to determine what do we need for training capacity, what do we need for expansion when it comes to that. As an example, adding 550 more training seats across 18 different healthcare designations, the expansion of or the creation of a new occupational therapy training program that will be developed at the University in Saskatoon. That would be an example. But again, I think most importantly that the agency would be working closely with immigration and career training, advanced education, to make sure we're identifying where are our priority areas now, where are our priority areas in the future in terms of projected growth or demand when it comes to healthcare professions across facilities in this province as we continue to fill vacancies, address retirements, but also, with the expansion of building of new facilities often that have more beds, more services than previously existed. For example, today announcing the 100% completion of the Regina Urgent Care Centre project, that needs to be staffed, and that work is underway, which the Health Recruitment Agency will be engaged with the SHA as well. So they'll be working closely with all those partners to make sure that we have all hands on deck when it comes to doing those recruitments.
How will you ensure the success of those hard to recruit positions where we see significant gaps across the province? How are you going to make sure that we actually find people and fill those spots?
So it, I guess just to point to some of the successes we've had thus far, and we're being pretty aggressive on the 4-point Health Human Resources Action Plan, and just building on the previous answer I gave, it also encompasses a number of other ministries and agencies. It includes our partners at the SHA, and the affiliates, of course. It includes the new Sask Health Recruitment Agency and the work that that team is doing. There are additional funds in the provincial budget for HHR initiatives, nearly $142 million of a commitment for Health Human Resources. Nearly 1,100 nursing graduates from Saskatchewan and out of province have been hired here since December of 2022. Almost 280 physicians recruited to Saskatchewan since September of 21, including 120 family physicians and 160 specialists. More than 220 health professionals recruited from the Philippines have arrived in Saskatchewan, and nearly 140 are now employed in communities across the province. I mentioned earlier the new training seats, the 550 new training seats in critical health training programs in 2023. Nearly 80% of those available for the 23-24 academic year, with more becoming available this year, plus the College of Medicine seats. Those will increase to 108 undergraduate seats and 140 postgraduate residency seats for the fall 2024 intake. So that is, the work that is being done, and the results we're seeing thus far from the Health Human Resources Action Plan since its launch in the fall of 2022, and we'll continue to build upon that. As I said previously, the creation of new training programs, i.e. occupational therapy. Last Friday, I was in Kindersley, joined by our partners from Advanced Education and the Regional College, where they announced they'll be establishing a practical nursing program in Kindersley to serve West Central Saskatchewan. And when I was there talking to some of the nurses and those that work in the health facilities in Kindersley and the surrounding area, they spoke very highly of how important that will be. A lot of excitement around having that option for training in rural communities. So I think between the expansions at our post-secondary institutions in Regina and Saskatoon, at Sask Poly, at the universities, continuing to collaborate and look for new and creative ways to expand those training opportunities in our rural centers through regional colleges, and also the ability to use virtual and online options as well. I think that's a benefit. And then just continuing to engage with, especially frontline healthcare providers, but also community leaders with healthcare foundations in all of these communities. The work that's being done by the Health Recruitment Agency, the presence it is having at events such as SARM and SUMA coming up next week, and the direct engagement with communities right across this province, and then identifying where it is through our partners in the SHA and the ministry where we have vacancies to fill, where we're projecting to have greater need for certain healthcare designations, to make sure that we're always building towards that. So those would be some of the metrics that we use. Of course, the additions of some of the incentives to recruit to hard to recruit designations in rural and remote communities, that's been extremely successful as well. The work being done in our emergency medical services, additional funds towards EMS in this year's budget. Bursaries were provided last year in the summer for those training in EMS. Again, a significant uptake and interest in those. So I think lots of positive things happening, and we'll continue to watch the Health Human Resources Action Plan evolve in the months ahead.
Thank you. I'm wondering if you're working on establishing an Indigenous recruitment and retention plan.
So when we launched the Health Human Resources Action Plan, there was a reference as well with respect to further engagement and greater engagement with our First Nations and Métis partners, specifically talking about further advancing connections with Indigenous technical institutes such as the Gabriel Dumont Institute, the Saskatchewan Indian Institute of Technologies, SIAT in Saskatoon, and the First Nations University of Canada. And even more specific to that, I've had numerous conversations with First Nations leaders on healthcare projects and priorities across this province. As an example, around the Prince Albert Victoria Hospital project. I've had an opportunity on several occasions to meet with and be part of conversations with Prince Albert Grand Council and Grand Chief Brian Hardlott and their involvement, and they're directly involved as part of a committee working on that group or on that particular significant project for Prince Albert and area. So that is an example as well. We're working closely with groups like PAGC, and there's other examples around the province, Whitecap Dakota First Nation and Chief Darcy Bear and some of the initiatives that he is advancing. Speak regularly with him, as well as representatives from the FSIN. I know I have ongoing conversations with Vice Chief David Pratt as well on a number of issues. In addition, though, in the HHR plan, there is work that is being done towards having the SHA work with partners to develop a First Nation and Métis recruitment and retention strategy, and that will be significant as we're working to build capacity. I think, for example, in addition to Prince Albert and the Victoria Hospital project there, we also have a significant investment in more long-term care beds in the community of L'Orange, which will have a significant First Nations population there that it's serving, and that we will want to have employed in that facility in good paying careers in healthcare. But maybe just turn it over to Andrew to get into a bit more detail on some of the work that the SHA is doing and engaging with First Nations and Métis partners on some of these strategies.
Thanks, Minister. I'll maybe just start by saying, how important it is that we be committed to truth and reconciliation, and certainly that is something that the Saskatchewan Health Authority is committed to. And as part of that commitment, we do have a goal to increase the number of First Nation and Métis employees across the province. We do have within the Saskatchewan Health Authority First Nation and Métis Health portfolio and a leader that is part of our executive team helping us champion this work. And I would just say specifically as a part of the calls to action, number 23 speaks to increasing the number of Indigenous professionals working in the healthcare field, retaining healthcare providers in Indigenous communities, and providing cultural competency training for all healthcare professionals. I'm really pleased to share that, consistent with the Health Human Resource Action Plan, we have established First Nation and Métis Health recruitment and retention strategy. We developed that in a good way through active engagement with our Traditional Knowledge Keepers Council, but also with First Nations across Saskatchewan. So maybe just to elaborate on that engagement a little bit more, we as I mentioned, in addition to engaging our Traditional Knowledge Keepers Council to get advice on the process, we did engage healthcare leaders and providers from tribal councils, independent First Nations and Métis Nation Saskatchewan between October 2022 and February 2023. We just want to acknowledge, those communities and leaders for taking time to share their insights and their experiences and guide in the development of our First Nation and Métis recruitment and retention strategy. All of our engagement sessions were held in treaty territories and opened in a good way by elders. I'll just say the way that we've organized the plan really mirrors the Health Human Resource Action Plan, with a focus on recruitment and retention and training and incentives. I wouldn't, happy to go into more details, but I will just say, as a part of that, I'll just highlight some successes that we've had. Sorry, get the right page here. So as a part of this process, we have had outreach through Indigenous educational student centers to Indigenous students across all disciplines, and that's occurring to build relationships and provide information on career opportunities. We also have connections with high school career counselors, and we're engaging them to provide career information about opportunities that are available within the Saskatchewan Health Authority and the health system. And we've been attending career fairs and really, promoting both clinical opportunities but also non-clinical opportunities. Also really pleased to that we have a number of expanded healthcare training seats, specifically in partnership with the Saskatchewan Indian Institute of Technologies, and this includes an expansion of mental health and wellness and healthcare, and also a healthcare aid program with an additional 20 seats added in March 2023, and an increase also of Indigenous practical nursing seats. The SHA also has a partnership with the Dumont Technical Institute with additional continuing care seats and also an expansion of practical nursing seats. Through our partnership with Gabriel Dumont, we've developed a terms of reference, and planning is underway with a strong focus on northern community health and training and supports that they could provide, particularly with the redevelopment and expansion of the Prince Albert Victoria Hospital, and also L'Orange and the long-term care expansion that's happening there. We see those as really good opportunities. I'm also happy to share that we have initiated, just want to get the right words here. Very much. Well, if I could say though, cultural responsiveness training within our Saskatchewan Health Authority staff, and since January we've trained 13,000 staff in cultural appropriateness, which I think really helps support retention of First Nation and Métis staff as well, by promoting cultural understanding and breaking down some of the barriers and myths that people have based on their own personal experiences.
Thank you. We're running out of time, and I got pages of questions to ask here still, but do we have any physician assistants that have been hired in Saskatchewan so far, and if so, where are they?
So we have 11 postings for physician assistants, and we're in the stages with one of the potential applicants in the final reference check stages, and with another applicant in another location, we're in final interview stages.
Where are these positions being trained currently?
So there are currently 3 institutions across Canada training physician assistants. There will be 2 additional institutions coming online, I believe, fall of this year. And then the U of S program will start taking intake students. The plan is for them to start taking intake the fall of 2025.
Okay, thank you. Are we still sending patients out of province for knee and hip surgeries? And if so, how much have we spent on that in the last fiscal year? Or the last 3 quarters if you don't have the full year?
So as of March 3rd of this year, we've had 90 surgeries have been completed in Calgary. So those people are removed from the wait list here in Saskatchewan at a cost of roughly $2.25 million.
And what was the time frame for that, the 90 surgeries?
Let's see. So we announced that the initiative started in April of 2023. So from April 2023 to March 3rd of this year, that's the time frame.
Thank you. What is the status of the hyperbaric chamber in Moose Jaw?
So thanks for the question. The hyperbaric chamber in Moose Jaw requires 4 respiratory therapists to resume full operation. 3 of the 4 are recruited and are currently being trained up to operate that unit. And the 4th position is currently being recruited. And once that position has been recruited, then there will be a full resumption of services.
Is there any services or treatment from the hyperbaric chamber happening currently?
So currently, as staffing allows, there has been a partial resumption of services, and one patient is currently receiving services, given the partial staffing that is afforded currently.
Is there a wait list to access this treatment currently?
So we are aware of 2 patients requiring the hyperbaric chamber service. One is currently receiving that service, and the other is currently building a plan together with the physician.
Thank you. Just wondering, so if a patient is sent out of province because the hyperbaric chamber has been closed for the last 2.5 years, if a patient is sent out of the province for this treatment, is there any reimbursement for their travel or accommodations to access this treatment, just like we have seen with breast cancer care to Calgary?
There are only limited circumstances under which we would cover the cost of travel and accommodation, but we do cover the cost of treatment received out of province.
Thank you. I've been told that my time is up, so thank you.
Thank you. Having reached our agreed upon time for consideration of these estimates, we will adjourn consideration of the estimates and supplementary estimates number 2 for the Ministry of Health. Minister, do you have any closing comments?
Thank you, Madam Chair. Just a thank you to the members of the committee here today for asking the questions, to our officials at the ministry and the SHA, the staff in our offices for their support here this afternoon and this evening in answering the questions as they've come forward, and look forward to additional questions tomorrow.
Mr. Clark, do you have any closing comments?
Yeah, I'd like to echo the minister's comments, just saying thanks to all the folks, the civil servants here today, to the deputy minister, to the ministers. I must admit that it feels a little bit weird to be sitting on this side and speaking with a full bench and no one was heckling me during my time. So I really appreciated that. Maybe that can be taken back to caucus by the members that are present, but thank you for all you do across the province in providing healthcare to Saskatchewan people. It is very valued and very appreciated. I also want to say thanks to the clerk and to Hansard and the folks manning the cameras. It takes a lot to make this happen here. So thank you to everyone for being patient with me today on my first budget estimate.
Thank you, Mr. Clark. I too would like to thank the ministers and the officials present here today, and the committee members for also being in attendance today. And thank you for all the staff from the Legislative Services for staying with us and for the good work that they do. That concludes our business for today. I would ask a member to move a motion of adjournment. Mr. Kading has moved. All agreed? This committee stands adjourned until Wednesday, April 10th, 2024 at 3:30 p.m. Have a good evening, everyone.